Good morning, everyone! Good morning, mga kasambahay! Welcome to another enlightening episode of Doctors on TV, the show that brings you medical insights and expert advice on a range of health. I'm your host, Dr. Barba-Cabodil. Another inspiration, another motivation to make positive changes for your physical, mental, and emotional well-being. Pero bago ang lahat, mga kasambahay, kayo ay aming iniimbitahan na i-follow and subscribe ang aming mga social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv and like and subscribe to our YouTube channel. Just type www.youtube.com/@UNTV News and Rescue. And you can actually send us questions po and mga comments sa mga pages na yan. Kaya nako, after liking and subscribing, i-share nyo na din po sa inyong mga friends and family. Alam niyo ba, mga kasambahay, na kung maaari pong magkaroon ng brain damage from birth injury ang isang sanggol, pwede po itong mangyari before, during, or shortly after the birthing process. And also, the child can suffer a lifelong physical or mental disability because of this. At maaari rin pong maging resulta nito ay ang pagkakaroon po ng kondisyon na tinatawag na Cerebral Palsy. Alamin po natin ang iba pang mga paunang detalye ukol po dito. Let's watch this.
Did you know cerebral palsy is the most prevalent motor disability experienced during childhood? The term cerebral pertains to the brain, while palsy refers to weakness or difficulties with muscle use. According to the estimates of Centers for Disease Control's Autism and Developmental Disabilities Monitoring, or ADDM, cerebral palsy is the most prevalent motor disability among children, with approximately 1 in 345 children identified as having cerebral palsy. This condition is more common among boys than girls and is more prevalent among black children than white children. The majority of children with cerebral palsy, around 75% to 85%, have spastic cerebral palsy, which results in stiff muscles and awkward movements. However, over half of the children, about 50% to 60%, can walk independently.
This condition that we all need to learn, the more knowledge we gain, the more na pwede din po tayong makatulong sa ating mga kapwa. Lalo na kung mayroon po tayong mga kakilala na nakakaranas ng ganitong kondisyon. And for deeper understanding about this, stay tuned. Doctors on TV will be right back. Welcome back to our show. Moving forward to our discussion, sa mga natutunan po natin kanina, madudugtungan pa po yan ngayon. Kaya atin po munang pasimulan ng ating introduction. Let's watch this.
Cerebral palsy is a group of neurological disorders that affect movement and coordination, caused by damage to the brain that usually occurs before, during, or shortly after birth.
For us to be able to understand more this topic, today I am privileged to introduce to you our guest for today's episode. She is here to share her insights and experiences about those affected by this condition. Let us welcome Dr. Myrna Fojas, a pediatric neurologist from Makati Medical Center. Good morning, Doc Myrna. Welcome to Doctors on TV.
Good morning. Magandang umaga, mga kasangbahay.
Yes, and thank you, Doktor, at pinaunlakan niyo po kami ngayong araw para mas marami po tayong matulungan na ating mga kasangbahay. And ito nga po, sa panimulang tanong, Doktora, can you explain more what exactly is cerebral palsy?
Well, ang cerebral palsy is a condition mostly seen in children wherein they have problems in movement, in posture. That's about it. No? It's usually secondary to a brain injury. So, the brain injury, pwede mag-range yan. Pinaka-common is panahirapang mga anak ng ina. No? Okay. Yung nanay, nakulangan ng oxygen, yung bata habang nilalabas nila or still in the womb. Mm-hmm. And because of the lack of oxygen and even lack of blood, nagkakaroon ng brain injury.
I see.
So, paglabas ng bata, usually hindi mo kaagad mapapansin na meron siyang cerebral palsy. But as they grow older, mapapansin mo there will be a problem in motion, in movement, no, muscle movement, in posture too. And sometimes it's complicated by muscle coordination, including eating,
I see.
swallowing, no?
And Doktora, how soon po bago makita, bago ma-diagnose na ang batang ito pala ay may cerebral palsy?
Children follow a normal development, motor development. Makikita mo sa cerebral palsy, even in the early stages, iba na yung tone ng muscle nila. Matigas, yung iba sobrang lambot, no? Tapos, as they get older, you expect them to be walking by one. And a lot of them, delayed ang walking, no? Pati pag-upo, delayed din. So, doon mo mapapansin, naku, suspicious na to, may cerebral palsy siya.
I see. And kanina na-mention nyo, di ba, about parang meron pong nagkaroon ng oxygen depression nung time ng panganganak ko ba? Or...
It could be before, it could be during, it could be also after, as long as the injury occurs in a developing brain.
Okay, so you mentioned about injury. So can this also be secondary to trauma?
Sure. It could be secondary to trauma. It could also be genetic. No?
Oh, so there's also
genetic in a way that, because there are some children with the congenital brain malformation, no?
I see.
And some of them have syndromes which causes them to have delayed and problems in movement.
I see. And ano pa po yung ibang mga common causes of cerebral palsy?
Well, you've mentioned infection is one of them, like meningitis, no? Or infection when they're pretty young. Bleeding, like a stroke, no? Or hemorrhagic encephalopathy. Pero the most common is both a congenital malformation or, yun na nga, a problem in delivery.
So ito pong genetic predisposition, okay, so kung nagkaroon pa
Not a
ng...
genetic predisposition. There are some people children born with a syndrome.
I
Or
see.
some children born with a congenital malformation.
I see.
Not due to delivery or anything.
Okay, and ito pong mga na-diagnose sa cerebral palsy, I mean, are they affected the same way po? Pare-pareho po ang manifestations ng cerebral palsy?
No. That depends on what part of the brain. Remember, ang cerebral palsy is a problem with movement, posture, that is secondary to a brain injury or brain deficient. Basta the injury is in the brain, no?
Okay.
Not in the muscle, peripheral nerve, but in the brain.
So, depende kung anong part ng brain.
Kung depende sa anong part ng brain, the symptoms are gonna appear. Depende sa what part of the brain is injured. For example, if it is the fronto, mahirap nang sa, common terms. Kung ang na-injure ay yung parte ng brain na nagko-control ng muscle, or movement ng arm, ng legs, then medyo may hemiplegia yung bata.
I see.
No? Kung ang posterior fossa or ang cerebellum ang na-injure, then makikita mo hypotonic yung bata. At sometimes, mga bata na malimit they move a lot. No? Pero, yung voluntary, movement, nahihirapan sila.
So, this involves primarily the motor,
Motor
the motor
system,
function
yeah.
or the motor system of
Function.
the patient. So, how about po yung brain functioning?
Brain function. May mga CPs na normal lang intelligence and they go to school, no? But depende sa amount and how great the injury in the brain. Kung masyadong malaki, of course, they're mostly associated with mental retardation, no, cognitive delay, and also sometimes with behavioral problems, no. Nakakalimutan ng iba na a lot of them are having difficulty in swallowing and feeding as an infant, no. Because yung coordination ng mga muscles for swallowing is also affected. Marami sila may problema din sa mata because that's part of muscles, no?
So, very saddening din pala talaga, no? So,
Depende actually
extent.
yan sa extent, no? Kung grabe yung injury, katulad ng severe yung kanyang hypoxic ischemic encephalopathy, a lot of them will have seizures and mental retardation,
I see.
no? And movement problem. Ngayon, kunyari hemiparesis lang, isang konting malparte lang ng brain na a lot of them will have normal intelligence and they can go to school.
And in your practice, have you seen some
yeah.
achievers also?
Oh, yeah. I have children
among CP
see them na
patients?
tapos na sila ng college and they're working.
That's good to know. Yeah, but
No,
can
so
this be
not
life-threatening
necessarily.
also?
Is it what?
Can cerebral palsy be life-threatening?
life-threatening. Remember, ang cerebral palsy, once nagkaroon ng injury, that's it, no? Is it progressive? It's not, no?
Yeah.
But in a way, progressive kasi yung muscles, kunyari contracted yung muscles or laging rigid yung muscle. But you cannot stop the bone from growing.
Yeah.
Right? So the child continues to grow. Diyan nagkakaroon ngayon ng contractures.
I
So
see.
nagkakaroon sa parang pretzel, contracted yung arm, contracted yung knees, and yung toes, no? And yung feet. So in a way, it is a little progressive, even if the injury is static. No, na ganun hanggang doon na lang yung injury, pero since growing lahat ang bones and muscles and all, naapektuhan yung posture ng bata, yung magkakaroon tayo ng contracture sa legs, contracture sa arms, and even in the spine.
Pero kanina na-mention nyo, meron nakakapagtapos hanggang college. Okay,
Depende nga sa injury, no?
So does it mean na parang pwede rin sila like, normally working after their education?
There are a lot of hemiplegic. The injury was occurred during childhood. May hemiplegic sila, pero they continue to work as an adult.
Can we elaborate what hemiplegia is for the benefit?
Paralysis or problem or weakness on one side of the body. Okay, so maraming bata na gano'n. They continue, normal function in life except problem in movement.
I see. And we've seen naman a lot of support system, di ba? Parang, they hire also, they provide jobs for these kind of patients also.
They do, but these children, they have to go to a lot of rehabilitation, physical rehabilitation, exercises to prevent contracture. Importante doon if it is a spastic cerebral palsy, you really have to prevent spasticity and contractures. And ang treatment dyan is, siyempre, yung range of motion ng joints is important, but some will go for Botox injection. But that's very temporary. It takes them 4 months, 6 months, babalik na naman yung rigidity.
That will be costly kasi mahal din ang Botox.
Oh yeah, that's why we cannot sustain it in most of my patients here in the Philippines.
I see. And
but in some, if they do it and nahihirapan sila sa contracture, both Botox and even surgical management is by the orthopedic.
I see. So there's like a co-management. Okay.
Yeah, kasi gawa ng contractures.
Yeah. And Doctora, is this really, how is the prevalence rate here in the Philippines? Is this very common?
For me, it's common because that's my specialty.
Yeah, I've seen a lot, I'm sure.
I don't know. Depends siguro sa amount of injuries to the brain is occurring in children.
And Doctora, in your practice, how young po yung fatal cases, yung madaling namamatay?
Well, it's not because of the cerebral palsy.
But it's
because of the brain injury. Kasi marami din sa may CP na may epilepsy. No? Marami din naman nawala, no? Pero so it doesn't necessarily na may CP ka, meron kang epilepsy. Marami sa kanilang meron, pero it's not 100%.
So it's really a case-to-case basis.
Yeah, it's a case-to-case basis.
Okay, and kamusta po yung pagbisita o pagdating sa inyo kaagad ng pasyente? Kalimitan po ba na diagnose early on or?
Alam mo, you have a hint of who's gonna have CP. Kung nakita mo yung bata during delivery and they were referred to you and you say, naku, pwede itong magkaroon. Kasi nakikita mo na yung brain injury from the ultrasound, from the MRI, from the CT scan. So you kind of prepare the parents already for that. There's some that walks in because of it, but nakikita mo na the way the child behaves na meron siyang CP.
Yeah.
So,
pero usually, how do you come up with the diagnosis of cerebral palsy?
Physical examination. No, you will just observe the child and you will notice that they have a delayed in motor development. No, they have a certain posture. Kasi CP can be from very mild to very severe. Yung severe being bedridden sila. No, na they cannot move. They not move naman. They can move, but with limitation. Those are severe types. No.
How about the
yung
mild
type, they can still walk without support, no? Managing very well. Walking alone. Yun. Meron kasi, yung meron niyang spastic cerebral palsy, may hypotonic
When you say spastic, yun
yung matigas.
matigas.
And
then,
those are the
next
ones
type
that
po.
is prone to contracture.
Oh, kaya
No?
dapat may rehabilitation
Yun ang
you mentioned
rehab.
a while ago.
Meron ding hypotonic CP. And a lot of children with
Yung
this
hypotonic naman, yung
malambot.
Okay.
Lambot, no? So, kailangan din nilang rehab.
Do you
Teach
find a
them.
combination of both, Doctora? Seldom.
Yung severe will have hypertonicity
Malambot
of
na
the
malambot.
extremities.
Yeah, but
no? Pero minsan yung neck nila,
ang matigas.
malambot.
Ang malambot.
Hindi nila maano. No?
Okay.
There's a combination. But you usually name them according to what area is more severe than the other.
Ah.
No, meron din yung chorioathetoid, yung mga
Yung mga movements.
yeah,
Certain
para silang
movements.
dancing.
Mm.
Pero a lot of those children starts with hypotonia. And then later on, katulad ng mga may yung masyadong hyperbilirubinemia, yung masyadong madilaw as an infant, no? And that is one of the side effects. Nagsi-cerebral palsy din yung mga bata.
Naku, kaya napaka-importante. Di ba po yung pagbata, monitor yung levels ng bilirubin, di ba? Kasi
Depende
pag
kung
madilaw ang bata, kasi yun yung inaiwasan, parang may certain cut-off, okay, sa level.
Yeah.
Actually, that was my fear also before, na kailangan talagang babaran, okay, ng light yung mga anak ko. However, we had to, I have kambal, Doctora, if I may mention, and kailangan namin ilabas ng hospital kasi kailangan ko ibilad ng matindi sa araw because the critical, the bilirubin levels then, really so high, baka magkaroon ng kernicterus or magkaroon ng mental retardation.
Yes, kernicterus is the one that's causing the movement problem.
I see.
Nasa loob ng brainstem, ang brainstem and the inner nuclei of the brain are the one affected with the bilirubin.
I see. Okay, yun nga yung takot ko that time, Doktora. That's why, yun po kaya natin binabahagi sa ating mga viewers para hindi natin baliwalain yung paninilaw ng mga babies upon delivery. Okay, and yun po, Doktora. Okay, so to continue with the diagnosis, no, I mean, apart from the physical examination, you also request for some imaging studies.
Well, we tell the parents, depende sa kung magkano ma-amount ng... Kasi MRI is very expensive.
Yeah.
No? If you're doing an MRI on a child na kailangan pa ng anesthesiologist for an infant. Di ba? So the amount becomes tantamount, masyadong mahal sa iba. Pero kung gusto ng parents malaman, of course, an MRI, a CT scan, pero MRI is the best.
Yeah.
No? Can be done. Ultrasound sa mga newborn, ginagawa namin yan. So that's okay. That is just to confirm kung anong nakita mo, yun pala ang lesion, yun ang lesion, just to confirm. But a lot of cases, I don't even ask for it na. Kasi nga, I would rather spend their money for rehab.
For the management.
For the rehab. Kasi mahal din ang rehab eh.
Yeah.
Per session din
Saka
yan. And it's lifetime.
Yeah.
Almost lifetime in a way.
So, Doctor, you're very compassionate. Thank you for that. I'm sure na marami talaga kayo natutulungan, po. And, eto po, naku, makasambahay. Ito, I hope na iintindihan niyo pong mabuti ang aming tinatalakay mula kanina pa ho. No? Pero bago po natin ipagpatuloy, pansamantala po muna natin ititigil ang ating talakayan. Kaya wag po kayo maglilipat ng channel. Doctors on TV will be right back. At para pa rin po sa pagpapatuloy ng ating talakayan, still here with us is Dr. Myrna Fojas, a pediatric neurologist from Makati Medical Center. Ito, Doktora, ito naman, magtungo naman tayo sa mga prevention po, the preventive measures. So, Doktora, what is the concept of prevention of cerebral palsy?
Prevention, first of all, ang premise natin is CP is because of a brain injury. So, you prevent the brain injury.
So, to prevent CP?
Oo, to prevent CP. So, for example, in patients with, in mothers expecting, they really need to have a good follow-up with their OBGYN to be sure that the baby is in good condition, that they are drinking whatever or preventive measures like hair vitamins, etc., etc. No? For some children, the mothers, they should prevent infection, and that could mean vaccination. As a matter of fact, meningitis now is I haven't seen too much of meningitis because of the presence of vaccination. So, importante yung vaccination kasi pagka na meningitis yung bata, sigurado may sipin. I mean, a lot of them, not naman
Mataas yung
sigurado.
chances.
May malaking chance na magkaroon sila ng cerebral palsy because it's a brain injury.
Yeah.
Okay? Yung kernicterus can be prevented, no? Yung jaundice. So, it's all prevention.
Napaka-importante dito, nakikita natin na dapat alagaan mo yung pagbubuntis. And probably, paghandaan mo ito para at least kung maayos ang, ang nanay, chances are maayos ang bata sa loob.
Unfortunately, hindi mo maano yung congenital malformation, no?
Yeah.
Minsan may congenital malformation kasi mali ang diet ng mami or it's just in the genetic thing, no? Chromosomal problem. So that is not preventable.
And also probably, doktora, yung hindi natin maiwasan din kung kunyari biglang malaki pala yung baby and the trauma and the difficulty during the childbirth.
Kaya nga, they should have a good OBGYN to prevent hypoxic ischemic encephalopathy.
Sabi nga natin, mahirap din yung mga non-modifiable factors, okay? But when it comes to treatment, doktora, paano po yung management? Upon seeing a patient with cerebral palsy, kalimitan po, which direction do you go?
Alam mo, the most important, I will tell the parents, no, or the mother especially, that they should go for rehabilitation, no? That means physical rehab, sometimes minsan pati language at saka whatever, no? The children will be taught on how to walk, how to maintain a posture, no? So iba-ibang technique sila, yung depende na yan sa physical rehab MD, no? Kung anong i-recommend niya. Approach. Yung severe spasticity, they can wear some form of a brace para hindi maging karoon ng contractures. All of that will be dealt with by the physical rehab MDs, no?
I see.
So, is it a lifetime thing? A lot of times, matagal yan. Kasi you will never, first of all, we tell the parents, you cannot expect the child to be normal. Normal in a way of walking, of being a ballerina, no? They have to be realistic on what they could expect on a child, no? Yun, ang expectation ng parents ang pinaka-importante. And you have to tell them that, this is just the start of your battle. Your battle should continue on kasi kailangan mong to prevent contractures on the child, to teach them how to walk. Minsan kailangan ng braces, no? So that is very important for the parents to be prepared for this.
So it entails a lot of understanding, no? Para at least buong family can really support the kid.
Kasi nga, depende sa severe CP, may problema pa sa feeding. So, minsan naka-NGT tube yung bata or naka-PEG. No? So, depende nga sa severity of CP.
I see. Okay, so talaga palang napakalaki nitong problema na to, no? And so talagang kailangan maging handa ang buong pamilya. Okay, and usually, so apart from that, doktora, so na-mention natin kanya rehabilitation, what other, iba pa bang treatment options that we can...
Well, yung sinasabi ko sa'yo, Botox is one of them, but very expensive kasi you have to do this almost every 6 months, 4 months to 6 months.
So many units will be required.
Kasi yung muscle is marami. Usually, the big muscles are the one affected no? Like sa paa, yung hamstring, yung quads, gastrocnemius are usually affected. Kung severe ang contracture, of course, you have to refer to the orthopedic for release, no? But other than that, ganun lang ang ginagawa natin. It's all supportive.
I see.
Can you treat an injured brain? You support it, but I don't think it could really be treated in a way na back to normal.
So kasi permanent din ang permanent cells ang ang brain cells. Okay.
So it is difficult to say na pwede mo bang i-treat ang CP? The injury has been done.
Yeah.
It's been injured.
CP is actually an effect.
Yeah. So what you do is supportive. And prevent the complication of CP katulad ng contractures.
I see. And doktora, sa mga nakikita niyo sa patients, ano yung mga ibang activities na pwedeng ma-engage po yung mga bata just so we can, they can like prevent these contractures that you were mentioning?
The parents has to know how to do the exercises, how to stretch it, because if you can only go for rehab twice a week, once a week, 3 times a week, but it has to be something continuously done at home. No? If the child is intelligent enough, they could engage in very, very entertaining activities. No?
Even outdoors.
Even outdoors, there's no problem with that.
Have you seen like some CP patients going to swimming?
Yeah, swimming is good for them.
Yeah, kasi di ba maraming muscles
wala
na
naman,
nagagamit.
sa akin ha, as long as the patient can do it, fine, go. Because you really have to support them both psychologically, physically,
And socially.
No?
So the most effective treatment for cerebral palsy would always be the combination of all these.
Of course. It is.
So there's no single treatment for CP.
You know, when you manage a CP, it's a combination of, it is a work between the child neurologist, the rehab, no, even the teachers. You get involved. It's really a community of working together.
Okay, so does it suffice to say na, doktora, yung mga pasyente nyo ng mga bata pa nun, yun pa rin yung hinahandle nyo until now? Because, this is a lifelong...
Ngayon kasi ang tendency is once they reach the age of 18, you transfer to an adult. No?
Yeah.
Which is fine. Pero may iba na gusto talaga sa'yo.
Kasi kayo na yung nakilala.
Pagka 18 and they're working and they're functioning except for a light plegia, then that's fine. They continue and Pero yung mga bedridden, medyo mahirap, at saka yung mga wheelchair bound, medyo nahihirapan mag-transfer sa ibang neurologist.
Yeah.
Kasi medyo severe sila.
At saka syempre, siguro, especially with nung bata pa nag-start, familiarity also with them and the
pero
trust
we
with
do
the
encourage
doctors.
them to go for transfer services to an adult.
Of course, kasi they're special needs, okay, for special age also. And so, it means, Doktora, I think, parang how important is cerebral palsy awareness? I mean, para
It is important so that you can do preventive care. Parang magkaanak na may CP. Kaya nga, kung buntis ka, be sure that good ang iyong follow up. Though, of course, there are times na talagang wala kang magagawa katulad ng biglang nagkaroon ka ng bleeding, no?
Yeah.
I mean, you cannot help that. Pero at least for the others, just be sure that you have a very healthy pregnancy and delivery, no? And your vaccination is very important, no?
Make sure complete. Yan.
Kasi nga, to prevent meningitis, no?
Yeah.
Ganun lang, mga preventive measures.
Kaya lang, Doktora, di ba, may mga inevitable, like for example, parang at an older age, kunyari ang isang babae, no? Okay, so parang bigla na lang nabuntis. Of course, syempre, parang it's hard also to be, as normal as a younger female, di ba? Parang ganun. Or, like for example, also, basta anything na biglaan. Like ako, I remember, na when I was pregnant, when I wanted to get pregnant already, so, kung baga plano ko, December so, as early as May, talaga, ang bait ko, Doktora. I mean, I engage myself into healthy lifestyle, even the food.
Importante yun.
Parang inayos ko talaga yung body ko, kasi sa akin magsistay yung baby.
Okay,
and then,
so, yun, you have a good, pregnancy is very important. Number 2 is yung infection, controlling infection. Number 3 also is, of course, the accident prone.
Ay,
So, yung seat belt is very important when you carry your children. I mean, bring the children in the car. All of those are preventive.
Kaya nga, di ba, Doktora, sa ibang countries talaga, it's imperative na meron daw na car seat for kids. Yeah, para naiwasan yung mga brain injury.
Oo. So, it's a prevention of brain injury, actually.
Okay, so pag na-prevent natin yon, eto na, wala tayong problema with cerebral palsy. Okay, that's it.
Yeah, except yung mga
Meron na.
congenital.
Yeah.
May mga congenital, wala kang magagawa.
Wala
Congenital talaga.
yun. And of course, a lot of prayers, no, di ba, para for a safe pregnancy. Naku, Doktora, dami namin natutunan sa inyo, no, and baka meron po kayong final words for our viewers, Doktora Myrna.
Well, I think prevention is the best medicine, no? Kasi once it has occurred, it becomes permanent. And you have to learn how to live with it. Okay?
And you might want to invite our mga kasangbahay po to visit you here at Makati Medical Center.
Oh yeah, they're always welcome. Yeah. Unfortunately, I have only a Saturday clinics.
And try other services here also at the center.
Yes.
Okay, thank you very much once again, Dr. Myrna Fojas, a pediatric neurologist from Makati Medical Center. Sana po mga kasambahay may mga natutunan kayo sa ating mga tinalakay ngayong araw. Naku, pero hindi pa po nagtatapos dyan. Stay tuned. Doctors on TV will be right back. That brings us to the end of today's enlightening episode. Naku, but before we say goodbye, I would like to greet my kambal, Iyo and Iya. Happy birthday, mga anak. Palagi kayong magpakabait, ha? And susunod sa inyong mga magulang. And of course, hi to Doc Alain and kay EJ. As we wrap up today's episode, we'd like to extend our gratitude to all our viewers for their continued support. We hope you found this discussion informative, empowering, and inspiring. Remember to follow us on social media for updates. Don't forget to tune in next time, God willing. Muli po, maraming salamat sa inyong lahat. Ito po si Dr. Sarah Barba-Cabodil. Let's make it a habit to learn about good health. Only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsolo Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor Ayala North Exchange Tower 1, Legazpi Village, Makati City. Mestiza soaps. Mestiza soaps are made with natural ingredients and a combination of vegetable and fruit extracts, which can be also used by children and pregnant women. Good news is that these beauty products are vegan and cruelty-free. For inquiries and orders, contact 0969-175-4231-33 or 02-8824-5217 or 02-881-30320. Organic Acai. Support your health with a 100% organic superfood supplement, Organic Acai Premium Blend, and Acai freeze-dried capsules. Rich in powerful antioxidants, fiber, amino acids, vitamin C, omega fats, and other essential nutrients the body needs to help build stronger immunity against illnesses and help increase your energy. Organic Acai is available in all Mercury drugstores and other leading drugstores and supermarkets nationwide. Linden Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgcsalesco@gmail.com. And of course, salamat sa ating partner, ang DepEd Santa Rosa, sa pakikiisa sa ating adhikain na maibahagi ang kaalamang pangkalusugan. Clinica Figura. You may contact them at 0917-317-7272. Medical Depot. Healthy Nom Nom Food. Barba-Cabodil Holistic Health Group, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Please like and follow Facebook page, Dr. Sarah Barba-Cabodil. Special thanks to Dr. Gia Grace B. Sison, Head of Makati Med Wellness Center. Attorney Pilar Nenuga P. Almira, President and CEO. Dr. Saturnino P. Javier, Medical Director. Ms. Arlene L. Sonco, Senior Vice President. Ms. Monica Reyes Dizon, Assistant Vice President. Mr. Mark Funelas, Unit Head Manager, Communications and Special Projects.